With the onset of monsoons, a lot of patients of mine are experiencing eye complaints, especially irritation of the eyes, rubbing, itching, burning of the eyes. So you've guessed it right. Hello and welcome back to hashtag Ask Dr. Namrata, and today we'd be talking about conjunctivitis or inflammation of the conjunctiva. So what is conjunctivitis? It is the inflammation of the transparent membrane that lines the eyelid and the eyeball. So when the blood vessels in the conjunctiva get swollen and irritated, they become more visible. Hence the whites of the eyes appear more pink, and therefore the name pink eye or conjunctivitis. What are the causes of conjunctivitis? Majorly it is caused by viruses or bacteria, and in both these conditions the conjunctivitis is highly contagious. There is discharge from the eyes, itchiness, irritation, and it is easy to spread from one eye if it is infected to the other eye, which is normal. Now next cause is allergic conjunctivitis, which is generally caused due to allergens like pet danders, like dust, like mites. When we talk about the next cause, it is irritants, and in this case the irritants can be smoke or certain chemicals or foreign objects that enter the eye. In this case, however, the conjunctivitis is not contagious. What are the symptoms of conjunctivitis? Like I have described a few of the symptoms since the beginning. There is redness of the eyes, there is itchiness of the eyes, irritation present in the eyes, there can be a gritty feeling in the eyes, or there can be discharge from the eyes which is sticky and which makes the eyes difficult to open up in the morning, especially if the discharge has been throughout night. And there is photophobia, which is also known as increased sensitivity to light. How does conjunctivitis spread? Though it is not a very serious illness, but it is highly contagious. So it can actually spread by coming into contact with an infected person's discharge. So avoid shaking hands with an infected person. Also avoid using personal hygiene products with an infected person, such as towels, handkerchiefs. Then avoid sharing makeup products like brushes, eyeliners, kajals with an infected person rather. What are the precautions you can take if you are down with conjunctivitis? First, you must follow a very good hygiene practice. Wash your hands with clean water and soap, and also avoid touching your hands if they are unwashed to your eyes, so that you can prevent infecting your eye. So talking about management of conjunctivitis, there are certain measures that you can definitely follow at home. If you are down with conjunctivitis, see to it that you stay back at home. Even school children should not be sent to school, since they can infect other children very easily. Next thing is, try using certain cold compresses over your eyes. Dip clean cloth in cold water and put it over closed eyes. If you feel that warm compresses will make you feel better, you can go ahead with them. Also, if there is distress due to a lot of sensitivity to light, you can use glasses. Another thing is, you must see to it that you rest enough and follow the hygiene methods which I have already described. When we talk about homeopathic management, there are beautiful remedies in homeopathy which actually resolve the first inflammatory stage of the disease. Remedies like euphrasia, remedies like belladonna, aconite, they beautifully bring down the inflammation. Then there are a lot of other remedies which are symptomatic, like apis, like merc salt, arsenic alb, and these are definitely used if the symptoms or if the presentation of the case indicates so. None of the patients or none of the viewers who are viewing this are supposed to buy these medicines. They were just clinical tips for my fellow homeopathic students. I hope this information was resourceful to you, and up till my next video, stay healthy and stay fit.